Dementia is not a single disease. It's a general term used to describe a group of brain disorders. It mainly affects memory, thinking, language, judgment, and daily functioning. Dementia is caused by damage to brain cells, which interrupts the communication between them. It is one of the leading causes of disability in older adults worldwide. The risk of dementia increases with age, but it is not a normal part of aging. Dementia can also affect younger people. This is called early-onset dementia. Common signs and symptoms of dementia. Memory loss that disrupts daily life, especially short-term memory. Difficulty performing familiar tasks like cooking or driving. Trouble with language, forgetting simple words, or using the wrong ones. Disorientation, not knowing the date, time, or place. Poor or decreased judgment, especially in financial decisions. Problems with abstract thinking, like understanding numbers. Types of dementia. Alzheimer's disease, the most common type of dementia, around 60 to 80% of cases. Caused by abnormal protein buildup in and around brain cells. Leads to progressive memory loss. Symptoms worsen over time and eventually impact physical functions. Vascular dementia, caused by reduced blood flow to the brain, often due to strokes or blood vessel damage. Symptoms include thinking problems, confusion, and trouble focusing. Memory loss may not be the first symptom. Preventable through managing blood pressure, cholesterol, and diabetes. Lewy body dementia. Symptoms include memory loss, hallucinations, movement issues, and sleep disturbances. Often misdiagnosed as Parkinson's disease. Frontotemporal dementia, FTD. Affects the frontal and temporal lobes of the brain. Leads to changes in personality, behavior, and language skills. Often occurs at a younger age, 40 to 65 years. Causes and risk factors. Age, most common in people over 65. Family history or genetics, having a parent or sibling with dementia increases risk. Head injuries, especially repeated concussions. Cardiovascular issues, high blood pressure, stroke, and heart disease. Diabetes and obesity, linked to brain degeneration. Smoking and alcohol abuse, damages brain cells. Depression, long-term mental health conditions can contribute. Sedentary lifestyle, lack of exercise and social connection increases risk. How dementia affects daily life. Trouble shopping, managing bank accounts, or taking medicine. Risk of accidents, forgetting to turn off the stove or leaving doors unlocked. Emotional effects, anger, paranoia or fear. Increased need for home care or nursing home placement. Diagnosing dementia. No single test can confirm dementia. Doctors use a combination of tools. Medical history review. Looking at symptoms, family background. Cognitive tests, such as memory and language assessments, neurological exams, reflexes, balance, and brain function. Brain imaging, MRI, or CT scans to detect strokes or tumors. Blood tests, to rule out vitamin deficiencies or thyroid issues. Mental health evaluation, to rule out depression or anxiety. Treatment and management options. No cure exists, but some treatments can slow progression and manage symptoms. Medications, cholinesterase inhibitors, for example donepezil, to boost memory and thinking. Regular exercise and healthy diet. Occupational therapy to maintain independence. Speech and language therapy for communication skills. Music or art therapy to reduce anxiety and boost mood. Can dementia be prevented? While not all cases are preventable, you can reduce your risk by keeping your heart healthy. Avoid smoking. Control blood pressure. Eating a Mediterranean-style diet rich in vegetables, nuts, and healthy fats. Staying physically active, at least 30 minutes of moderate exercise daily. Keeping the mind active, reading, puzzles, or learning new skills. Staying socially connected, engaging with friends and family. Getting enough sleep, 7 to 8 hours per night. Managing stress, anxiety, and depression.